I've been warned you're a tough crowd, so I don't know. What I'd like to do is tell you a little bit about CDC, tell you a little bit more about the area of wellness in the workplace, because I think this is an area where we can do a lot more, and it's good for the bottom line, it's good for the community, and it's where CDC has some resources that we can provide, technical and other. And then to really open it up and have some time for discussion, questions, and answers, I want to really thank the Georgia Chamber for hosting this and having me here. I really appreciate the opportunity to connect with you. I also want to thank the CDC Foundation and the former board chair, Phil Jacobs, who couldn't be here with us today, but who's been so important in so many of our activities. The CDC Foundation is CDC's nonprofit partner. They help us do more faster. And Charlie Stokes is here. Charlie, can you just raise your hand? If you don't know Charlie, please get to know him. He's a great guy. And we work with lots of businesses. We have a business council at CDC, and we see our role as promoting health for everyone. We are the nation's prevention agency, and we can be, I think, quite important in forging partnerships that don't exist already. Our approach really is to work 24/7 to save lives, to protect people, and to save money through prevention. That's fundamentally what we do. Save lives, protect people, and save money through prevention. We work 24/7 to protect Americans from threats, whether they come from this country or abroad, whether they're infections or environmental risks or non-communicable diseases. We also support state and local governments, and we have nearly $250 million a year, every year, coming into Georgia through vaccines, infectious disease prevention efforts, stopping heart disease, stroke, and cancer and diabetes, preparedness for emergencies, and a variety of other areas. Oops. Heart attack, cancer, stroke, and diabetes undermine productivity. They account for about 7 out of 10 deaths in the U.S. each year. About half of all Americans live with at least one chronic illness, and the cost is over $1.5 trillion a year. It's about 75% of our health care costs. And tobacco use remains the single leading underlying cause of death. 45 million Americans still smoke, kills over 440,000 people a year. More than half of all kids who live in non-smoking homes are exposed to cigarette smoke in the community. And the cost of medical expenses is nearly $100 billion a year. Tobacco and other preventable things cause 4 basic problems: heart disease, stroke, cancer, and diabetes. And those 4 account for a huge proportion of our healthcare costs. Now, we all want to do a better job caring for people who've had a heart attack or a stroke, but it'd be even better if we could prevent that heart attack or stroke from happening in the first place, and that's what we're working on. Obesity is epidemic, and I'm sorry to say this while you're eating dessert, because it's a good dessert. I had it. It's a good dessert. I had it. And everything in moderation is fine. Maybe I'll work out a little harder at the gym this afternoon, but obesity is epidemic. No one could have predicted that obesity would get as bad as it got as quickly as it got. We've got really an enormous burden of obesity in this country. It is 2/3 of all adults are overweight or obese. 1/3 of all kids are overweight or obese. We have 90 million people who are overweight or obese. $150 billion in medical care costs. Someone who's obese costs about $1,400 more to care for per year than someone who's not. And obesity causes a whole range of health problems. It increases the risk of stroke and diabetes, heart disease, and arthritis, gout, cancer, liver disease, really a range of problems. Heart disease and stroke are leading killers. It's just terrible to give this talk while you're eating, but I'm a doctor, and we just tell it like it is, or we try to. 2 million Americans have a heart attack or a stroke every year, and most of those heart attacks or strokes are actually preventable. and the costs are quite enormous. So now I want to tell you about the Million Hearts campaign that we launched a year ago. Because heart disease and stroke is such a huge problem, we think actually we can do a lot about it. We can prevent 1 million heart attacks and strokes by 2017. So it's an ambitious goal, it's a measurable goal, and we think we'll do that by doing two broad things. One is healthier people, the second is better medical care. And those two things are related, but they're also somewhat different. So community prevention will give us healthier people, less need for treatment through tobacco control, decreasing sodium intake. And this isn't about taking away people's salt shakers. Actually, we encourage people to salt food to taste. The problem is that in a lot of the processed and restaurant foods we get, they have a huge amount of sodium in it. If you made that in your kitchen, you wouldn't put as much salt in it. You might want to put 8 or 10 shakes of salt into your breakfast cereal, but you don't have to because they're already there. So we want to put power into people's hands and decide how much to put in. Turns out a little bit of sodium over many years causes a huge problem in terms of blood pressure. And the Rand Corporation estimated that if we just could reduce sodium a bit, we'd save $30 billion a year in healthcare costs and trans fat elimination. Now, a lot of corporations are doing great work in this area. The food industry has gotten half of the trans fat out of the food supply over the past decade. That still leaves half, the harder half to get out, so it's going to be harder to get the rest out. Walmart Corporation has committed to within 5 years eliminating all trans fat, getting a 25% reduction in sodium, and making unhealthy food and healthy food about the same cost. Currently, I spoke with them. They're very interesting. They're very committed to trying to do a better job, and they said their number one food item is macaroni and cheese. They sell a mountain of macaroni and cheese every day. And you can make a healthy macaroni and cheese with lower sodium cheese, with whole wheat macaroni, and it tastes just as good or better. But it used to cost twice what the unhealthy macaroni and cheese cost. So they were committed to getting the costs of the unhealthy items no less than the cost of the healthy items. In the clinical sphere, in the doctor's offices, it's a focus on the ABCs: aspirin for people at high risk, blood pressure control, cholesterol control, and smoking cessation. Those 4 key things. Health information technology can make a huge difference. It's not the be-all and end-all, but if you were trying to run any business and you didn't have information about what was going on, it'd be a lot harder to do. So electronic health records can make a huge difference in care. And team-based care and clinical innovations. We just had, last week, I was out in Denver recognizing 2 champions of Million Hearts. One, the Ellsworth Clinic in rural Wisconsin, and 2, Kaiser Permanente in Colorado. They're about as different as 2 organizations can be. The Ellsworth Clinic is 3 doctors in a private practice in a rural area, and they have 698 patients with high blood pressure. Kaiser Permanente of Colorado has 540,000 members and 88,000 people with high blood pressure, and I don't even know how many staff and doctors and others. But what was really interesting is that they had come to exactly the same place. They got we recognized them because they both got well over 80% of their patients' blood pressures under control. And that's way better than we do as an average nationally. And they did it through 3 key innovations. The first was focus. Telling people it's important, measuring it every month, giving feedback every month. The second, and you can do that because there's a national indicator called the National Quality Forum Indicator 18, which we think should be the single most important indicator that we track in the healthcare system, because it will save the most lives if we improve it. It's blood pressure control. So they focused on that. Second, they used health information technology, so they could figure out who was coming back, who wasn't coming back, who was in control, who wasn't. And the third, they used the whole team. Now at Kaiser, where they have a salaried model and they have a very large operation, they had a call center with 17 pharmacists. And they call every patient who didn't show up for their appointment to have them come back, or didn't pick up their prescription to have them come back. And if they don't answer the pharmacist, they have the doctor, the primary care doctor, call them. In Wisconsin, it was the medical assistant who basically learned to do care management and called people, brought them back, made sure they were on care. There's not rocket science here. It's about doing good care, making sure that people get the care that they want and deserve so that they're not going to have a heart attack or stroke. We think that this will mean 4 million fewer Americans smoking and 10 million more Americans with their blood pressure under control. If we fail to do that, it's going to cost a lot of money. As I mentioned, $1,400 more per year for someone who's got high blood pressure, $2,000 more per year for someone who smokes, and $6,600 more per year for someone with diabetes. So these are really costly conditions if we don't prevent them. Prevention's a best buy. Healthier communities are more productive. Prevention increases the health value for health dollars, and prevention can reduce the per capita annual health care cost. I was in I've been in a lot of states. I'm trying to remember where Herndon is. I was in Mississippi, and one of the towns there won a competition for the healthiest town. And they won that by doing a whole host of things, getting schoolyards renovated to be tracks and places for people to work out, having walkable streets, going smoke-free in their restaurants and bars. And what they found was suddenly they had people moving in. For the first time in 40 years, they had a new business starting in their town because people saw it as a good place to live, just as people are concerned about how good the schools are, people are how good the environment is, people are concerned about how healthy communities are, and it makes a big difference. It's a best buy. Preventable health problems, as you all know, can be very costly for employers. Each year, millions of people are diagnosed with chronic diseases that could have been prevented, and that means higher health care costs, increased disability, lost productivity, lower productivity, higher absenteeism, higher turnover. Health and wealth really do go together. Chronic health problems have a large economic burden on businesses. There are about 450 million workdays lost. There are about 39 million of those are lost from obesity, and a lot of lost productivity. It's the Centers for Disease Control. So just to give you a little bit of information about that, I'll talk about it a little bit more at the end, but the Centers for Disease Control has about a dozen centers. One of them is NIOSH, the National Institute of Occupational Safety and Health. NIOSH works with industry and others to try to improve worker health, and one of their programs is Total Worker Health, to integrate occupational safety and health with protection and health promotion to prevent injury, illness, and advance well-being, with resources for employers and employees. This is an interesting analysis that was done a few years ago. What this looked at was health risks, major medical problems, smoking, physical inactivity, other things that increase health risk. And it looked at how high the employer health-related costs per employee were based on the number of risks that the employees had. And as you might expect, the fewer risks, the less the employers had to pay. So the base cost was around $4,600. This is 2006. But when you added 3 or 4 risks, you had more absenteeism, more medical claims, and more pharmacy claims. And if you had 5 or more risks, you had a lot more pharmacy claims, and you had really twice the overall spending. So an employee who has those kind of health risks is going to cost twice as much per year in healthcare costs. Investing in prevention, we think, makes a lot of sense for businesses. Individuals benefit. They're productive and they're healthy, both inside and outside the workplace. Businesses benefit. There are lower long-term health costs and higher stability and productivity and improved competitiveness in the market. And communities benefit. It's a more attractive place for families to live and businesses to locate. One of the things that CDC has done is provide information on purchasing health care. When you purchase health care, you may want to know what are some of the best buy services. And so we've provided some resources along with the business group on health for that to be smart purchases of health care. And 3 really key areas to mention are tobacco control, physical activity, nutrition, and influenza vaccination. Tobacco costs a lot of money for businesses. Smoking and secondhand smoke cost a huge amount, not just in healthcare, but also in productivity. Exposures of other people. Tobacco doesn't just kill the person smoking it. It can harm or kill the people around them from secondhand smoke, which causes cancer, heart disease, and other problems. Smokers take on average 2 to 4 more sick days per year than non-smokers. If you just add up a 10-minute smoking break a couple times a day, it adds up to as much as a month less at the desk per year. And the productivity costs are quite high, thousands of dollars a year. But there are lots of things that can be done to reduce tobacco use, implementing tobacco-free policies, offering help to people who want to quit, improving access, the quit line. It doesn't have to cost much, but can make a big difference. Physical activity and healthy eating, information and environment can be very helpful to make it easier for people to take the stairs. Some of the things that we do at CDC, we have some exercise groups. We encourage people to take the stairs. I do stair walks. It's a 12-floor building that we have, so it's a reasonable amount of exercise to take the stairs when you go up to the top, but good way to get people together. We have healthier food in our cafeteria. We have a farmer's market that we have regularly, and there's a presidential challenge of active lifestyle and I actually did this challenge myself. I have to say it was not so easy. You go for 6 weeks. You can get information off the website. You go for 6 weeks, and you have to, I think it's 6 weeks out of 8, you have to have at least 30 minutes of moderate to vigorous physical activity at least 5 days a week. Now, I didn't do that before, but ever since I did that challenge, I enjoyed it so much that I'm doing it more now. It's hard to build things like that into your schedule because we're all so busy, but it's possible, and the key is to help people find things that they enjoy doing. If it's a chore, we're not going to keep doing it, but if it's something we look forward to, whether that's taking a walk or a jog or doing something at the gym you enjoy, you're likely to do that regularly. Influenza. We're just starting influenza season. I think I'm actually going to get my flu shot later today. About 25 million Americans get the flu on average. It can be twice as many of that or lower in some years. About 200,000 can get hospitalized per year, and as many as 30,000 can die per year. The costs of flu are huge, billions of dollars. And I have to clarify, people get confused about what influenza is. Influenza is a specific virus. There are a couple of forms of it, but it's not the common cold. There are hundreds of kinds of common colds. They'll make you sick for a day or two. When you've got flu, you're really sick. People with flu, particularly the very young and very old, can die from it, and you really feel bad. The economic costs are substantial, lost work and productivity, and for employers, it's very costly. On average, someone with flu misses between a half a day and 5 days of work. And during flu season, unvaccinated workers can account for as much as 45% of all days lost from illness. And yet we have a good vaccine that works. Vaccinated employees have significantly fewer doctor visits, lost work days, fewer work days where they're not really present. And the vaccination costs are quite low. They can be quite low for the business and for the provider. Vaccinated employees are healthier, more productive, and less costly. There are things that workplace wellness programs do that are good for the employers and for the employees. For the employers, it's lower costs, less absenteeism, better productivity, turnover, satisfaction, and image. For employees, it's being healthier, less illness, lower healthcare costs, and a supportive environment. Now, what we found with companies that do workplace wellness is sometimes they're not sure if it's really made a difference in their healthcare costs, but if they do it well, they know it's helped their employees be happier and more loyal as employees. It's improved morale. These are just a few examples of employee wellness programs, everywhere from J&J with over 100,000 workers to a small employer with a few hundred workers. And there's fitness programs, there are comprehensive tobacco control programs, and the return on investment, the ROI, has been substantial. For example, in Highsmith, their healthcare premiums rose at less than half the rate of the national average. Here in Georgia, Fielddale Farms had their annual costs per employee substantially below industry average. At J&J, they saw their medical expenses actually decrease over a 4-year period. And at Union Pacific, they saw a big decline in tobacco use. We have lots of resources that can promote workplace wellness. And just to end with a little bit more about CDC before we go to a discussion, CDC is the top-rated federal agency in terms of what the public thinks of us. We have really more than 60% of the American people think we're doing a great job, and that's because we have so many great staff at CDC. It's an amazing institution. Any healthcare problem you think about, we have the world's expert pretty much within CDC. We have about 10,000 staff here in Atlanta. The payroll for Georgia is about $1 billion. We're among the top employers in Georgia. And we also purchase hundreds of millions of dollars from Georgia businesses each year. We also provide nearly $250 million to the Georgia state government each year for healthcare programs. And I do feel that we have a special responsibility to Georgia and to Atlanta because this is where we live, this is where we're based. And so we're very committed to doing whatever we can to help Georgia's health improve, Atlanta's health improve, and to use the resources that we have, the technical expertise we have, to help Georgia and Georgia business be healthy and productive. So I'm delighted to be here with you. Thank you all very much.